Whenever policy changes ripple through a nation, you'll often hear the buzz about broad benefits and the data-driven rationale behind them. But let's take a closer look, because for all the talk of inclusive progress and leaving no one behind, the reality can be quite different. Recently enacted policy shifts in response to various crises, be it economic, environmental, or public health related, have left some communities behind. Take, for instance, three places: La Portera, a small rural town; Riverside Estates, a bustling urban neighborhood; and the indigenous reservation at Red Willow. These areas found themselves not just overlooked, but often actively harmed by the very changes meant to help. So, what happened here? To understand why La Portera, Riverside Estates, and Red Willow face such stark disadvantages, we need to consider the history of policy design. Lawmakers often tout transformative policies as neutral and equitable. But history tells a different story. Remember the New Deal? It's celebrated for lifting America out of the Great Depression, but behind the scenes, it excluded many agricultural and domestic workers who were disproportionately African American through clever categorizations. Fast forward to today, and we see a similar trend. The latest policy changes, crafted mainly by experts in urban centers, aim to tackle post-pandemic educational inequities and healthcare shortages. While some praise these policies as ambitious and agile, many voices that mattered, those from rural, marginalized urban, and indigenous communities, were left out of the conversation entirely. Now let's dive into the specifics. La Portera, a farming town with fewer than 5,000 residents, was bypassed in the rollout of both digital and healthcare upgrades. The directives called for enhancements to telemedicine and online learning, but resources were funneled to areas with larger populations. As a result, La Portera's single clinic received just one computer, hardly enough to meet its needs. School students struggled with unreliable internet access, which local councilman David Ruiz pointed out was due to a metro bias in funding formulas. And it's not just rural areas that faced neglect. Riverside Estates, a densely populated working-class neighborhood, experienced a different kind of abandonment. Here, eligibility for emergency educational grants was tied to school district test scores, unfairly penalizing neighborhoods with transient populations and struggling schools. Principal Lisa Eng shared how the grant applications seemed designed for stable, high-performing neighborhoods, leaving Riverside's largest schools with only a fraction of the funding they needed. Then there's Red Willow, where the misallocation of resources hit hardest. Federal health policies were based on census data that didn't accurately reflect the reservation's population. Advocacy groups had warned agencies about these gaps, but nothing changed. Nathaniel Baer, a health administrator at Red Willow, highlighted the dire consequences. They had to ration vaccines and supplies due to an undercount by at least a third. Even when the CDC confirmed the underestimation, policymakers shrugged it off, claiming systemic data limitations. Now, some advocates of these policies argue that resource constraints forced tough choices. A federal policy advisor noted that the interventions were designed using the best data available, aiming for the greatest good for the greatest number. While there's some truth to that, critics see this as an excuse for deep-seated biases and a lack of imagination. Experts argue that when funding decisions are based purely on easily measurable statistics, vulnerable populations get overlooked. It's also worth mentioning that some argue Riverside Estates benefited from indirect improvements, like better mobile hotspot coverage citywide. And eventually, Red Willow did see an increase in vaccine allocations, but only after the most critical phase of the pandemic had passed. Still, these piecemeal fixes don't address the core issue. The initial policies failed to account for the unique challenges faced by these communities. So, what's the impact of leaving La Portera, Riverside Estates, and Red Willow out of the early support? In La Portera, the lack of digital infrastructure has hindered economic growth, leaving local businesses struggling against online competitors. In Riverside Estates, insufficient educational funding risks perpetuating cycles of underachievement in a district already scarred by systemic neglect. Meanwhile, Red Willow's health disparities have led to a deep mistrust of external governance, fueling demands for more autonomy in health systems. While some short-term solutions might provide temporary relief, they won't bridge the gap without meaningful structural change. What's promising are ideas that suggest overhauling data collection, prioritizing needs over efficiency in budgeting, and ensuring local voices are included in policy design. In conclusion, the recent wave of policy responses promised a safety net that would reach everyone. Yet, for communities like La Portera, Riverside Estates, and Red Willow, that promise fell flat. The reasons are all too familiar: hasty decisions disguised as neutral, incomplete data guiding critical choices, and an underestimation of the value of marginalized voices. The real lesson here isn't just that better policy is possible, it's that true reform should be measured not in numbers, but in the lived experiences of those communities often seen as outliers. By putting humanity at the center of policy design and execution, we might finally bridge the gap between lofty rhetoric and everyday reality. Until that happens, any progress risks being nothing more than self-congratulatory posturing.